So you've been on that little purple pill for years now. Maybe your doctor prescribed it. Maybe you started taking it over the counter. Maybe someone told you it was completely harmless. And at first it worked. Your heartburn went away, your reflux settled down, and you thought, finally, something that actually helps. But here's what's happening now. Your muscles cramp at night. Your heart flutters for no reason. You're exhausted even though you're sleeping 8 hours. Your digestion feels worse than before you started. And you're starting to wonder if the medication is actually making things worse. And you're not wrong to wonder. Here's the thing you're never told. That medication was never designed for long-term use. It was designed for 8 weeks, maybe 12. Short-term treatment for a specific problem. But somehow millions of people have ended up on it for years. And the longer you're on it, the more your body pays the price. I'm Dr. Matt Mason, chiropractor, acupuncturist, and functional medicine practitioner. Today, I want to talk about the medication that's been handed out like candy for decades. The one most doctors treat like it's completely harmless. The one that's quietly depleting your magnesium, disrupting your gut bacteria, and potentially affecting your brain. I'm talking about proton pump inhibitors, PPIs, Nexium, Protonix, Prevacid, the names you see on the pharmacy shelf and think nothing of it. So by the end of this video, you're going to understand exactly what this medication is doing to your body, why your doctor probably never mentioned the risks, and most importantly, what you can do about it, whether that means tapering off safely, supporting your nutrient levels, or addressing the root cause of your reflux so you don't need the medication in the first place. Let's start with a question most people never ask. What is this medication actually doing to you? Well, the physiology is straightforward. These drugs work by blocking the proton pump in your stomach. That's the pump that produces acid. Block the pump, stop the acid. Heartburn goes away. But here's what you're not being told. The acid wasn't there just to make you uncomfortable. It was there to digest your food, to kill pathogens, to signal your body to absorb nutrients. But when you block stomach acid for weeks, months, or years, you're not just turning off heartburn, you're fundamentally altering how your body processes everything you eat. Now that might sound dramatic, but let me show you what I mean. Let's talk about the most immediate problem, magnesium. Your body needs stomach acid to absorb magnesium. That's just physiology. So when you suppress acid production, magnesium absorption drops significantly. And magnesium matters for everything. Muscle relaxation, heart rhythm, nerve signaling, sleep, mood. Over 300 enzyme reactions in your body depend on magnesium. So what happens when you can't absorb it? Those muscle cramps at 2 a.m. That eyelid that won't stop twitching. Heart palpitations that make you wonder if something's really wrong. Anxiety that sits in your chest all day. Fatigue that no amount of sleep seems to fix. These aren't random symptoms. They're your body telling you it's running low on one of its most essential minerals. But here's the trap. Your doctor runs a blood test. Your serum magnesium comes back normal. And you're told everything's fine. You've heard me say this before. That blood test only measures 1% of your magnesium in your bloodstream. The other 99%, it's in your cells, your bones, your muscles, and your body will literally drain magnesium from your tissues to keep that blood level looking normal. So you can have low magnesium where your body actually needs it the most, even if your blood tests look completely normal. And your doctor dismisses your symptoms because the numbers say you're okay. That's not a failure of your doctor. That's a failure of the system. The test was never designed to catch what's actually happening. And here's something really interesting. Researchers have found that taking a PPI changes your gut bacteria so dramatically that it may actually be more disruptive than a course of antibiotics. Think about that for a second. So here's what happens. Your stomach acid normally acts like a gatekeeper. It kills off bacteria that enter your body through food. But when you suppress that acid, bacteria that never should have made it past your stomach start setting up camp in your intestines. So bacteria from your mouth, your throat, species like Streptococcus and Veillonella, bacteria that have absolutely no business living in your gut. And when these bacteria take over, they crowd out the beneficial ones that are supposed to be there. Your gut becomes less diverse. And that matters because a rich, diverse microbiome is one of the strongest signs of a healthy digestive system. So when diversity drops, your gut becomes more vulnerable, more prone to inflammation, more susceptible to problems. And some research has even found a connection between long-term PPI use and a higher risk of developing inflammatory bowel disease. Because when you disrupt the gut environment that much for that long, people who are already susceptible to gut issues can be pushed over the edge. So think of it like this. Your gut has a certain amount of resilience, a buffer zone. But if you're constantly suppressing stomach acid, altering your microbiome, and changing how your digestive system functions, that buffer zone shrinks. And for some people, that's enough to tip them from a healthy gut into a condition like IBD. So, in other words, it's not that the medication directly causes the disease, it's that it creates the conditions where the disease is more likely to take hold, especially in people who are already vulnerable. Now, let's talk about your brain. There's a concerning connection between PPIs and dementia risk. There have been many studies that have found the link between long-term PPI use and increased cognitive decline. So this is something that deserves our attention. So how does stomach medication affect your brain? Two pathways. First, vitamin B12. Your stomach acid is required to release B12 from food. Without acid, B12 absorption drops significantly, and B12 is essential for cognitive function. Deficiency has been linked to nerve damage, memory problems, and dementia. Second, PPIs may actually cross the blood-brain barrier. That's the protective layer that normally keeps harmful substances out of your brain. And some research suggests that once they get in, they could interfere with something called amyloid processing. Now let me explain what that means. Amyloid is a protein that your brain produces. Normally your brain clears it out like taking out the trash. But if that clearance system gets disrupted, amyloid can start to build up. And here's the concerning part. That buildup of amyloid protein in the brain is one of the hallmark features of Alzheimer's disease. So the concern is this. If PPIs interfere with your brain's ability to clear amyloid, could long-term use contribute to cognitive decline over time? The research also raises questions about neuroinflammation, inflammation in the brain itself, which is another factor linked to dementia and memory problems. Now, I want to say that this isn't an attack on these medications. PPIs have legitimate, sometimes life-saving uses. Bleeding ulcers, Barrett's esophagus, severe GERD that's seen on endoscopy. The problem isn't the drug itself. The problem is how it's being used. And the data on that is worth paying attention to. So listen to this. Studies have found that 25 to 70% of patients on PPIs lack a valid indication for their use. In nursing homes, over 27% of residents were on PPIs inappropriately. No clear reason, no clear benefit, just years of continued use. In hospitals, up to 90% of patients get started on PPIs without a clear indication. And once people start, they rarely stop. 35% of patients treated for peptic ulcers continued PPIs beyond the FDA-approved 8-week duration, often for years. The average overuse duration? 346 days. That's almost a year. I don't know about you, but I see a problem with that. 25% of PPI users have been on them for more than a year. 28% have been on them for more than 3 years. This isn't medicine. This is a mass medication of a population for a problem that may not even exist anymore. So why don't people stop? Because when you try to stop, the rebound hits. Rebound acid hypersecretion. That's the medical term. And it's exactly what it sounds like. Your stomach has been suppressed for so long that your body overcompensates. When you stop the medication, your acid production skyrockets. And I've looked at clinical studies where 44% of people who stopped a PPI after 8 weeks developed acid-related symptoms from rebound. Heartburn, regurgitation, dyspepsia, symptoms that feel exactly like the original problem. And here's the trap. You think the medication was working, and you think your reflux is back, and you think you need to get back on the drug. But what's actually happening is withdrawal. Your body is overshooting. And if you restart the medication, you're just reinforcing the cycle. So here's the truth. The system isn't designed to help you get off these drugs. Your doctor may not even mention rebound acid because they assume you need the medication anyway. Now let's talk about what you could actually do about this. Here's my practical step-by-step approach. Step 1. Determine if you actually need this medication. Were you prescribed it for a clear reason? Barrett's esophagus, bleeding ulcer, severe esophagitis documented on endoscopy? Or was it prescribed for vague symptoms? Heartburn, indigestion, or just in case? If you don't have a clear medical indication for ongoing use, you may not need to be on it long term. Step 2. Don't stop cold turkey. If you decide to discontinue, you need to taper off slowly. Cut the dose in half for a week or two, then reduce the frequency, then stop entirely. Give your stomach time to adjust and be prepared for rebound. And know that heartburn you experience after stopping may be withdrawal, not recurrence. Step 3. Address the underlying cause. Why did you have acid reflux in the first place? For many people, it's diet. Highly processed foods, excessive carbohydrates, insufficient protein, and large meals late at night are common contributors. Eating within 3 hours of lying down is one of the biggest triggers. Your body needs time to process food before you recline. So gravity helps keep acid where it belongs. And here's something counterintuitive. Low stomach acid itself can cause reflux symptoms. So if you don't have enough acid to digest your food, your stomach stays full longer, pressure builds, and the valve at the top of your stomach opens. That's reflux. So suppressing acid when you already have low acid can actually make things worse. Chewing your food thoroughly is one of the simplest habits you can adopt. Digestion begins in your mouth. So when you chew properly, you're signaling your stomach to produce acid. You're also breaking your food down so it requires less acid to digest. This single habit can dramatically reduce the burden on your digestive system. For others, reflux is driven by stress. Cortisol increases acid production and alters your gut motility. And so when you're stressed, your body shifts blood flow away from your digestive tract. It's a survival mechanism. Your body assumes you're in danger and prioritizes your heart and muscles over your stomach. But if you're chronically stressed, your digestion stays compromised. So simple stress management practices can make a big difference. Walking after meals, deep breathing exercises, even 5 minutes of slow, intentional breathing before eating can shift your nervous system into a more relaxed state. So your digestion works better when your nervous system is calm. For some, it's a structural issue, a hiatal hernia, a weak lower esophageal sphincter, and those may require more targeted intervention. Step 4, rebuild your terrain. If you've been on a PPI long term, your magnesium, B12, and calcium levels are likely affected. So support those nutrients through food first, and then targeted supplementation if needed. For magnesium, focus on dark leafy greens, pumpkin seeds, almonds, black beans, and avocado. But if you've been deficient for a long time, food alone may not be enough. In practice, I often recommend a well-absorbed form like magnesium glycinate or malate to support muscle relaxation, sleep quality, and nervous system balance. For B12, animal foods like beef liver, sardines, salmon, and eggs are excellent sources. But if you're not absorbing B12 properly, a liquid form called methylcobalamin can be a better option because it can bypass the absorption problems caused by low stomach acid. I've seen this make a big difference for patients who've been on PPIs long term. And also pay attention to your gut health. If you've disrupted your microbiome, you need to rebuild it. Fermented foods like sauerkraut, kimchi, and kefir. Prebiotic fibers from onions, garlic, and asparagus. And eat a variety of plants to support a wide range of beneficial bacteria. The more variety you eat, the more diversity you support. And you may want to consider taking a quality probiotic as well. And if you're interested in professional grade supplements to support this process, I've linked to my Designs for Health dispensary in the description below. Everything there is practitioner grade and formulated with quality in mind. Now, I want you to hear this clearly. I am not telling you to stop your medication without medical supervision. If you have a documented reason for being on a PPI, work with your doctor. If you're on a high dose, tapering may take months. But I am telling you that staying on a medication that you no longer need is not harmless. And your doctor may not bring this up because the system often focuses on adding medications rather than taking them away. Here's what I want you to take away from today's video. The question isn't whether PPIs are safe. The question is whether they're appropriate for you in the long term. Short-term use for a clear problem? Absolutely appropriate. Long-term use for vague symptoms that could be addressed with diet and lifestyle? That's a different conversation. So if you've been on a PPI for more than 8 weeks and you don't have a clear medical indication for ongoing use, ask yourself why, and ask your doctor the same question. Doctor, do I still need to be on this medication? Is there a plan to taper me off? And if I stop, what should I expect? You deserve answers to those questions. And if you found this helpful, please subscribe. It helps me continue creating content that challenges the system's assumptions and puts the power back in your hands. And if you haven't watched my video on magnesium and vitamin D, go check it out. Because if you're on a PPI, your magnesium levels are almost certainly affected. And that affects everything else. I'll see you in the next video.